logical to be added to the framework. So now we keep it simple. We do one by one to avoid those challenging questions.
Of course, that's the next project.
Yeah.
Then. Yeah. I understand. All right. I don't see any other questions. Maybe at the end we have still some time after the next talk. So thank you very much, Brigit, for this very nice talk and this nice discussion. And I'm also looking very much forward to the next presentation from Brigit Staatsen. I'm looking at my sheet here. So she's a senior researcher in healthy living environment at RIVM, the National Institute for Public Health and Environment in the Netherlands. And yeah, she's giving us a talk on public health foresight, looking at future challenges for environment and health. So we're really looking forward, Brigit, to your presentation. And yeah, the stage is yours. So please share the screen, and we're looking forward to your presentation.
Yes, thank you. You can see my can see my screen, right? Okay. Yes, yeah. Let's see, because I missed something here in my screen now. One moment, please.
Maybe here you can see a little bit.
Yes, it goes. Okay, thank you. Yes, and my apologies first that I'm not there in person, but it was for time reasons difficult to join. So thank you, and how nice that I can see you too right now. And also I missed part of the discussion because the connection suddenly disappeared. So I hope that doesn't happen again. And I'm building forward very nicely on what Brecht has been presenting. So I'm very glad that he was first and not me. I'm a part that I work for the Dutch National Institute of Public Health and Environment. I'm also chair of the Environment and Health Task Force of WHO. We will have a big meeting in 2 weeks. A ministerial declaration on environment, climate, and health is being prepared and hopefully will be accepted at next week. And I can assure you that addressing environment and health inequalities is also an important topic of that meeting. What I will tell you today is I will tell a little bit about a public health foresight study we did earlier in 2018 and not 2028. It will be very forward-looking. I'm sorry for that. And I will give you a quick look in the kitchen of what we're doing for the next public health foresight, which will be published in 2024. I will focus a little bit on the challenges for environment and health within that foresight study. And I'll also touch a little bit upon very little about regional perspectives. And then we hopefully have some time for discussion. So the foresight studies we do at RIVM, those are strategic foresight studies. And I will explain a little bit later what we mean by that. And the aim is to provide insight into the most important future trends and societal challenges for public health and healthcare in the Netherlands. And it's input for national and local or regional public health policy. We do this every 4 years. We had the first edition in 1993 already. We had an intermediate edition due to the related to the COVID pandemic. And we have a new edition coming up in 2024. And actually, the most important thing is that we do this together with stakeholders, with representatives from policy, from practice, from research, but also this year, very importantly, also from civil society. And so the products are important, but actually the process is as important. So what's foresighting? Of course, it's looking at possible futures. It's not predicting the future. We cannot do that, but it's looking at possible futures. And you have different type of foresighting. When you're talking about forecasting, then you're actually looking at very short time periods. You're looking at historical time trends, and then you try to identify, okay, what is the most likely for future. And you have the more scenario building type of foresight studies. So with, for example, what the IPCC are doing, that's really using scenarios, building and trying to see from, okay, what things are really connected, making different scenarios to look at the future. Those are mostly more quantified. And then we also have something which is called where we look at desirable futures, and then we're talking more about normative scenarios or perspectives. And within the public health foresight studies in the Netherlands, actually what we try to do is a little bit to combine it. We make distinctions when we talk about the results, but we also use normative perspectives to do the discussions with stakeholders from, okay, if this is what you desire, then it will mean that and that for possible futures, but also for possible solutions. And we also, within every foresight studies, you have the black swans, the unexpected things. And I must say, I think all the things we usually say are unexpected are also happening or have already been happening, such as the COVID pandemic. We said for years there will be a pandemic coming, and then suddenly it's there. So to start with the results of the earlier public health foresight study in 2018, there the question was, what will the health of the Dutch population look like in 2040 if nothing were to change from now on? And this is the model we used for that evaluation. I think for most of you it will be like familiar. You have all kinds of external developments. We call them actually the D-step factors, important drivers that influence determinants of health. For the determinants of health, we look at environment, lifestyle, and personal related factors. And then we calculate what Bert already was saying, when we look at the health status, we look also at quality of life and healthy life expectancy. And it's also very important if you look at from, okay, what you do is what are most important future trends to take into account, what are uncertainties, and to take into account that you have different type of uncertainties. So you have the statistical uncertainty, the data quality. You don't know everything yet because you don't have the evidence for all the risk factors you want to look at, and we have different norms and values. I heard people asking about the weights for the deprivation index. That plays a role here too. So to come back to the public health forecast and some results. I said we also looked at life expectancy. Well, so here in 2015, the life expectancy were about on average 82 years, and we expect that it will continue to rise. Although I must say this figure should be adapted now because we had a dip here due to the COVID pandemic. And also the life expectancy without limitations or in perceived good health, they are expected to increase. But you also see the difference. Bech was talking about the disease burden, but which shows also from the life or your quality of life lost because you have certain diseases. And you can also see the same in life expectancy. You have life expectancy, and you have a couple of years where you have limitations, and the limitations are expected to increase after 65 years of age. The big thing for, I think, all European countries, but here you see the figures for the Netherlands, is of course the change in demographics and the aging population. So in 2040, this is the last map, you see that a lot of the percentage of people older than 75 is enormously increasing. And this is another way of showing it. So we in 2040, we have a 55% increase in number of people aged 65 and older, and enormous increase in very old people. While on the other hand, we see that the percentage of people that are able to give informal care is also decreasing enormously. So you need more people who can give care, but you will have less of them in 2040. And of course, this also has an impact on the disease burden. If you have more elderly people, you will have an increase in dementia and arthrosis. And this is another way of showing the figures as what Brecht just told you. But here you also see that mental impacts, mental disorders are a very important part of the disease burden also in the Netherlands. So it's heart diseases, and it's lung cancer and mental disorders. We also look at trends in lifestyle factors or lifestyle associated factors. And this is also one of the big problems heading us. We already have a lot of people who are overweight, and the percentage will only increase. And actually here we don't see that much difference. We don't expect much difference between the different education groups. The difference here will be smaller. These are maps showing from the combination of lifestyle in different statistical regions or per neighborhood. This is a little bit showing where we have accumulation of certain problems, and the map on the right shows also the implementation of social assistance plans in neighborhoods. So you see here in the south in Limburg where there are certain areas known for the deprivation, and it has its health, but it also has environmental aspects linked to it. We also did disease burden calculations for the 2018 study. I'm sorry, it's not completely translated in English, but here, we said, okay, we should combine disease burden and mortality numbers. Because the disease burden is also, it's a very good metric, but also a complicated metric. So sometimes mortality is more easy to understand and to use. But if we focus here on the environment, these calculations for that period said, okay, the disease burden is of the total disease burden, 4% can be attributed to environment, and the outdoor air pollution is an important part of that. And here you have the figures, the numbers, and you see that especially outdoor air pollution, particulate matter and NO2, UV radiation is a big part of it, and a little bit of noise. But then I should say straight away, and that's also a little bit of problem with the disease burden calculations, the things you cannot quantify as yet, according to this methodology, are also not here in the figures. So for noise, I can say important health impacts there are sleep disturbance and annoyance. And annoyance is usually not accounted for in the disease burden. Sleep disturbance you can do, but you have to do some methodological work in order to do this. And the figures below show the impacts of indoor air pollution. And here you see this is passive smoking, but we also have, even in the Netherlands, also some radon and thoron problems in a number of dwellings. So the results of 2018 were really from okay, we still have a high disease burden of cardiovascular diseases and cancer. We see a problem in that we get more older people who have complex problems, who have dementia. How can we take care of them while we have problems with the number of healthcare givers, and the mental pressure on teenagers and young adults. And this signal, this late one, was already popping up before we were talking about the impacts on mental health from the COVID pandemic. So, quick look in the picture for the next health foresight study. Here the question now is, okay, we're looking a little bit more farther ahead in the time for 2050. And the main question is, what do we need to know? What do we need to do now in order to prevent negative impacts in 2050, but also promote the positive developments we may see? And we have a very complex context now. As I already described, we have the aging population, we have migration problems, we have a war and energy crisis going on. This morning you heard everything about climate change. We have still the late impacts of the pandemics. In the Netherlands, we see a big discussion. There's a lot of distrust in government and politics. We have a housing crisis. Well, but I think to still be positive developments. This sounds a little bit negative when I put it like this. The approach we're going to do for this public health foresight is that we look at 3 priority topics, which is healthy generation. So we look at the very young people and we look at the very old people and how that will develop in the future. Of course, we look at the healthcare and social domain, what are new priorities coming up there. And climate change and living environment is a big part of this public health foresight, which is actually a little bit new because usually environment is a small part. And we look at cross-cutting themes, and diversity and inclusion, or inequalities, is a cross-cutting theme. Infectious diseases and digitalization. And at the moment we are in phase 1. We're looking at identifying what are important trends we have to take into account, and what are the major challenges and impacts. And after the summer, we're going to start with, okay, since we have identified all these impacts, what are the potential packages of solutions we can think of? And we'll continue with discussion of stakeholders. The nice thing is we have how do you call it? A citizen council who is looking with us at these developments. And we also already performed 6 focus group discussions with young people. So to zoom in a little bit more on what we're doing for climate change and living environments, we've identified the major trends, the major challenges we want to look at, and we did that together with people in the field. Of course, a literature review, but we also try to quantify the health impacts of climate change. And here we used the scenarios from our Dutch Meteorological Institute, and we've already calculated the impact for the mortality related to temperature changes. And we have we'll pay special attention to behavioral change. What is the role of behavior when we're talking about solutions? And this is also maybe the model we look at, especially for the environment. So it's not only about, okay, we want to protect health as much as possible, and looking here we have the traditional risk factors, but also, of course, the flooding risk and heat, which are upcoming problems or ongoing problems, I should say. But we also want to look at, okay, how can environments be contributing to health and promote health? So, and then we're talking about, okay, should I invite people to be physical active, to provide opportunities for relaxation, for social contacts. And the other aspect is that an environment should also facilitate people to do what they like to do outdoors. So it's also, of course, talking about accessibility of services, but also the accessibility of, for example, public transport, things like that. So the future challenges for the Netherlands, they're not new. I think they're probably for all countries the same. Climate change, of course, is the biggest one, but dealing with biodiversity loss also has impacts on public health and, for example, our food production. Housing is a big problem. We have an enormous lack of dwellings. It's especially a problem for young people. And of course, air pollution, noise, I like ongoing problems. Although for air pollution, we say we have a big package of measures that is being implemented. And if everything will be implemented, we expect that the disease burden for air pollution will decrease in the next 10 years. And we have these important transitions. So we need cleaner mobility, we need cleaner energy or fossil-free energy, we need renewable energy, and also we need less polluting agriculture. And that all combines in this very small country. A quick talk about the cross-border topics. That's because I was looking for because usually sometimes in public health forecasts we also take into account regional differences, and we will try to do that for this foresight study too. But there was an interesting publication just recently from our Council for Infrastructure, and together with the Council for how should I say Public Health and Society. where we looked at these regional differences, and also they interviewed a lot of people, also from cross-border, also from the border regions. Okay, what kind of trends do we see? What kind of impacts do we see? And do we need new approaches? And one of the things that came up from that story, from that advice, was there's a transport, because we see that a lot of investments go to the densely populated areas in the Netherlands and less to the border regions. And it's like an increasing in incentives, because you get less money, you have less quality of public transport, and people will be more inclined to use the cars, and because they use it less, there will be less investments in new transport. So this is an issue, they say, we really should take this into account. Another strange thing is, for example, if you look at electricity networks, we have not enough infrastructure at this time for it to cover an increasing demand for electricity, because we using more electricity and less gas, while Germany has space in their electricity infrastructure. So these are like collaborations that are also from an environment, but also from health impact, important to look into. And of course, air pollution is cross-boundary, water safety. Well, we all knew what happened in Limburg a couple of years ago. But also on the positive side, the connection of cycling paths, looking into green corridors, not also only good for biodiversity, but also, of course, for the relaxation of people living in the boundary region. So these are just some things to touch upon, and I have some questions for you, maybe for the discussion. So, what do you think, if you were from this cross-border perspective, what would be important future things to consider? And maybe in the past we did regional environmental health foresight studies, and I wonder whether there would be some interest also in doing this in these regions. And that was it. Thank you.
Yeah, thank you very much for this very interesting, great talk. So the discussion is opened. Please, any comments or questions for Brigit? So you had a couple of questions for us, but still I'm going to ask a question to you. So what do you think could the cross-border collaboration here in the EURegio really, how can it really help to tackle those big issues, those big challenges? Because I know, of course, the cross-border issues are sometimes very challenging to bring all together. But how can maybe this also be a solution to some of those problems? Do you have any idea to that? Or this also is probably a broad question for everyone here, but you have the first chance to answer.
Yeah, I see people already sitting there. We I think can answer this question much better than I can. But if we take the example of the floodings of 2 years ago, and I think there was already good collaboration, but their communication is key. And in order to be better prepared, have all these communication channels available, and also have organized collective, how do you call it? Yes, you have this crisis. I'm sorry, I'm losing my English. You can do these exercises to collaborate in practice and see from, okay, let's say we have this crisis coming up, and how will it work together when we do this with the 3 countries? Because but maybe my colleagues from Limburg, if I don't know if they're here, can answer this better. I don't know whether you do this. I know it's been done nationally, but is it done international? Because but that's more from the from the prevention and from a better alerting than we are doing it now. But just this is a first idea.
Yeah, thanks. I completely agree that communication is the first very important step, and then of course there's many others. Yeah, please.
Where is it? Odile here.
Oh yeah, I already saw you. I thought from you can answer this question much better than I can.
You mentioned that you tackle climate change in your new VTV, and you focus on temperature change. So is it then heat, or is it more general? And then, so that's one question. And behavior changes you mentioned. In what respect? I didn't get it.
Yeah. Yeah, I didn't explain that too much. For the climate change, what we do is we have analyzed the relation between mortality and the development and temperature change in the Netherlands over the last 20 years. And then we derive, what's exposure response functions from that. And we use these estimates to project them on the scenarios for the future. But that's only indeed heat-related mortality. But it's already interesting to see that we see differences. So the last 10 years, it looks maybe that people are getting a little bit adapted to heat. But this is very preliminary. Don't cite this one. This is just but we also look at it in a broader sense. So from what can we expect for the development of infectious diseases, but also, of course, allergies is a very important one. But then we discuss more, based on the literature, based on other foresight study, then that we're doing really new calculations. And the question on behavior change, there, for example, if you look at transport, we look at the opportunities there. If you, what we say for behavior change, you have both. You have to make it as easy as possible for people if you want this behavior change, and you also have to work with incentives. And so when we're looking at interventions, we are having this in the back of our mind and what will work best. So that's more. It's more for the analysis than for this stage right now. Yeah.
Okay. Thanks.
Yeah, you're welcome.
So, any other questions? Yes, please. Right.
Brigit, I don't think you can see me, but thanks a lot. I hope you can hear me.
Yeah,
okay.
Now I see you. Hi.
So on one of the discussion points that you put forward, so the idea of performing a foresight study in the cross-border region. So a question that I would have there for you, and maybe also for discussion with the group, is the fact that the cross-border region is not an administrative or a legal entity. So there's not one policymaker or authority administration responsible for it. So how does that work in a foresight where you need to involve your stakeholders and come to a common view on the future?
Yes, what we do up to now is that we have discussions at national level with the stakeholders there, and and for the different topics we have stakeholder consultations from different levels. They do not always attend, so I'm not saying that we have the full picture, but I think that's the way also to organize it. And if you want to do something like this, then you should have the authorities from the different regions now and then coming together. And I think you do organize that. There are some collaborations going on. So, but of course there will be the difficulty of the data. Not all the data are comparable. Well, that's why we have best cost. So it will be a thing.
Yeah. Thanks. And I don't know if anyone here would have any thoughts on that. So is it maybe some of you have more experience in working in the cross-border context. So is this a problem or not necessarily the fact that you need to talk to different authorities, administration, and that there's no one single overarching authority?
That's why we're here today, yeah?
Yeah,
Because
but are we're not the policy makers.
exactly. So we don't have as you said, an overarching authority, but then what we try is in practice bring partners from different sides of the border together and build on projects. And we try to use the results of the projects to convince the policymakers there's still something we can do about it jointly.